Ever wonder if you're getting the most of your Medicare health benefits? Join us as we break down the complexities of Medicare into clear, actionable insights so you can make informed decisions for your health and for your wallet.
The information presented on this program is believed to be factual and up to date at the time of its recording. We do not guarantee its accuracy, and it should not be regarded as a complete analysis of the topics covered. Discussions and answers to questions do not involve the rendering of investment advice, personalized or otherwise, but are limited to the dissemination of general information. A professional advisor should be consulted before implementing any of the options presented. Measured Wealth Private Client Group is registered with the Securities and Exchange Commission and only transacts business in states in which it is registered or exempt from registration.
Welcome to Financial Futures, a Measured Wealth podcast powered by the team at Measured Wealth in beautiful Portsmouth, New Hampshire. Each episode, we're bringing you fresh insights on retirement, investing, and everything you need to take control of your financial future. Whether you're preparing for retirement or already living it, we're here to help you make informed choices with confidence. To kick off today's conversation, here's your host, certified financial planner and chartered financial analyst, George Zaharopoulos.
Joining me today is Paul Doran. Paul is the owner of Doran Independent Insurance in Wolfboro, New Hampshire. Paul is licensed in New Hampshire and Maine and has been a practicing health insurance advisor for over 30 years. Paul, welcome.
Hi, George. How are you?
Doing great, thanks.
Good.
So today we're going to be talking a lot about Medicare. And I heard that the open enrollment recently just ended. So tell everyone about your recent experience you and your staff had during this open enrollment period.
Yeah, this is great timing for this, George. It's late December, and we're just coming off of the open enrollment period. And this was a ride unlike any other we've had. The industry used the word disruption, which I think was a very good term. Unfortunately, there was a lot of upheaval, I'm going to call it, with the Medicare Advantage market. Unfortunately, there was almost 80,000 people in the state of New Hampshire that lost that coverage. Medicare supplement plans, are renewing great. Those are the other option that people have with Medicare supplements. And those are, health insurance for doctors and hospitals. And people generally have what's called a prescription drug plan as well. And we had 9 options for that for 2026. And that all went very, very smoothly. But the Medicare Advantage market this year during the open enrollment period was tough, not just for us, but unfortunately our clients and a lot of the new people that we saw.
So what happens in that circumstance? Do people just elect a different Medicare Advantage provider, or is there some action they need to take right away?
Great question. When their plans were ending, we had 2 very large Medicare Advantage companies, unfortunately, just up and leave as of January 1st. And they were a majority of that 77,000 people that lost that coverage. So they received letters to that effect, and Consumer Protection, thank goodness, got involved, and the insurance department got involved. And because this was of no fault of theirs, they are able to either go back onto a Medicare supplement plan and not have to answer any health questions, or yes, we could find another Medicare Advantage plan for them. But I'll tell you, a lot of them are skeptical. I don't blame them. Those were tough meetings to have. They're doubting Medicare Advantage. And again, I don't blame them for that. So a majority of our clients did go back onto the Medicare supplement and a Part D plan for 2026. And, we're going to, see how this moves forward.
Is that common for providers to exit Medicare on the Medicare Advantage side, or does this also happen on the Medigap side as well?
Again, a great question. Does not happen on the Medigap side. That is, strong, and probably because there's been such a history, and, Medicare and Medicare supplements have been around since the mid-'60s when it was first developed. Medicare Advantage plans, maybe 10, 15 years of history. So they don't have that stability that Medicare and Medicare supplements offer. So, we'll see.
Okay, great. Well, let's just break down Medicare to begin with. There's a Part A, there's a Part B, and then there's the Part D, which is the prescription drugs. And then there's the supplement plan, which is either the Medigap or the Medicare Advantage. But can you kind of break down, the difference between A, B, D, and then those supplement plans?
I'd be happy to. Part A, as long as you've worked 40 quarters, is a free insurance program for all of us when we reach age 65. It allows us to go to any hospital we want to go to in the country, which is great. And, you've paid into that system your whole working life to be able to have that ability. Part B is elective, and that is to basically have services outside the hospital. That's your doctors, whether that's your primary or a specialist, is the easiest way I can explain that. And there is a cost to that. And for the average income person, it's I'm rounding here, $200 a month. And if you're taking Social Security, that's coming out of your Social Security check. If you're not, you get a quarterly bill for that. Part D of Medicare was really a godsend for a lot of people. And again, that's not very old either, 15 years or so. And that gives people substantial help with their prescription drug plans. And in 2026, good news there is as long as your medications are under a formulary, the max out-of-pocket expense you'll have is $2,100. But again, it's very, very important when you're in the state of New Hampshire, in particular, that one of the 9 plans is covering all of your meds in order to be able to have that ability to have a max of $2,100. And then Part C of Medicare, that's the Medicare Advantage world, which again is totally separate from A and B in a Medicare supplement plan and then a prescription drug plan.
Okay. What are some of the key considerations that someone should be thinking about when choosing one path or the other?
Medicare supplement plans, when I'm sitting in front of somebody, I'm asking them, do you want the ability to go to any hospital, any doctor you want to go to? If the answer to that is yes, then I am taking that person down the path of a Medicare supplement plan because that's what they'll be able to do. If you're a person that says, I'm okay with going to any doctor, I'm okay with networks, I like the fact that I can maybe get some dental and some vision help, have everything on one card, and I don't mind doing co-payments, that kind of thing, then I'll talk a little bit more about Medicare Advantage with that person until, we get to a place where they're comfortable with all of the bells and whistles that go along with Medicare Advantage and, unfortunately, networks.
Mm-hmm. Mm-hmm. Yeah, a key consideration or key difference between the Medicare Advantage and the Medigap supplements, dental, vision, and hearing. So if you're not in a Medicare Advantage plan, are you paying for those on your own out of pocket?
You are. And there are individual companies out there and individual plans for that person that does want dental and does want vision. And, we're licensed with those companies. But it's not right for everybody. We have some leading questions that we'll ask, and we're happy to say, nope, you don't need it. Or, yes, you do need it, and this is the best plan for you.
Mm-hmm. Is this something they can change during every open enrollment period? Or if the first time you sign up for Medicare, are you locked into that forever?
You're not locked in, which is great. So there's no irrevocable decisions. During the open enrollment period, which is October 15th through December 7th every year, that's when you make changes for the following year, whether you want to change your prescription drug plan, your Medicare Advantage plan, because things do change, and that is something that everybody should be examining every year. For example, last year we had 14 Part D plans. Mm-hmm. This year we only have 9, so you really have to make sure that your medications are still under the formularies of those plans. With Medicare Advantage, you need to make sure that your doctors are still participating with that plan. So that's the time to do that and make those decisions.
On the topic of Part D, if someone doesn't take medications when they enroll in Medicare, should they even be, purchasing some sort of Part D coverage?
Yes, the answer is yes. We had 4 out of the 9 plans this year had a 0 premium plan. And that's literally what it means. You could have a plan, a card in your wallet just in case you get put on a med and you're not going to pay a premium. I know that's hard to believe, but again, you've been working your whole life paying into this system to have that ability to have a plan like that. And by doing that, you're going to avoid a future penalty, because if you don't enroll when you're first eligible, you are going to pay a penalty when you enroll in future years, unfortunately.
So Paul, if someone elects one coverage for 1 year, and they find out that maybe they made a mistake, it's reversible, because just the next enrollment period you can kind of unwind that and do something different. Or could you be in a position where you have to take some sort of health exam or something like to that effect? Qualification.
Yeah, you are. When you make your decision during the open enrollment period every year, you are in that plan for the following year. If you do want to make changes, for example, is if you want to go from a Medicare Advantage plan back onto a Medicare supplement plan, you are going to have to answer some health questions. The other way, if you want to go from a Medicare supplement plan to a Medicare Advantage plan, no health questions are asked.
Okay.
And if you want to change your Medicare Advantage plan, you can go from company A to company B, not have to worry about insurability and answer any health questions.
And that's interesting, because there's quite a vast difference in cost between each provider, correct?
Yes, there is. Yep. And that depends on the network. It depends on whether you're in-network, out-of-network with those Medicare Advantage plans. Sometimes a co-payment might be $0. Sometimes they might be $40. Sometimes they might be a percentage. If they're not in the network, your visit could be 15 to 20% of whatever they're charging. So you have to be careful with that and know exactly what's in your plan.
And that goes true for a Medigap coverage as well. Am I correct? I think they're all, from what I understood, the protection is similar. However, there could be difference in costs. And should someone just be looking for the lowest cost provider?
The provider, no. If you're on a Medicare supplement plan, you can go to, again, any hospital you want to go to in the country, and you can go to any doctor that accepts Medicare. And as long as they accept Medicare, depending on the co-payments inside your Medicare supplement plan, you're going to be fine. And the plans that we like and we're putting our clients into are $20 co-payments to your doctor's office, $50 co-payment if you have to go to the emergency room, 100% coverage in the hospital. And with the last couple of years, we've actually been using what they're calling high deductible plans. A very, very low premium, but you have a $3,000 annual deductible. And that's becoming more and more attractive to our clients, especially the ones that are coming off of Medicare Advantage plans and that have been paying, hundreds of dollars in co-payments and spending $400 a night every night they're in, a hospital. They're fine with that. And when they see a premium of $50 or $60 a month with a $3,000 deductible, that's very attractive to them.
Absolutely. Very interesting. Okay. So when should someone start thinking about Medicare? When does that come into play? Is it right at age 65, or should they be thinking sooner?
The average person, and when I say average person, what I'm talking about is income. If you're adjusted gross income, if you're filing a single return of approximately $120,000 or below, or if you're a married couple, $200,000 and below, you should start that process probably 6 months ahead of time. If you're higher than that on your adjusted gross incomes, believe it or not, you need to start a couple of years earlier than that. And the reason for that is there's penalties for higher income earners. It's called the IRMA. Mm-hmm. So working with your financial advisors, working with your accountants, you need to start a couple of years ahead of time, because Medicare and Social Security look back 2 years on your tax returns. So if you can start preparing when you're 62, 63 years old with your tax return, you could save yourself a lot of money. And earlier I had mentioned the average person's paying $200 a month for Part B. That number can go all the way up to almost $600 a month if you're a higher income earner. So, and then there's 4 different levels even between that. So again, paying attention to your tax return in your early 60s is smart to do.
Yeah, and Paul, that's a great lead into what we as financial advisors and planners do, making sure that long capital gains are taken in a year that doesn't affect the IRMA premiums. So coordinating income in that respect. And also, for a lot of people age 65 out there, they still might be working and they could possibly delay their enrollment into Medicare. How does that work?
Yeah, good. And that is as long as you're under group coverage, that means your provider is providing health insurance for you. You can work, till you're 75, 80 years old and have what's called a SEP, a special enrollment period, that allows you to go onto the Medicare program without any penalties. And, getting back to the financial planning of this, and I'm not a financial planner, but I've seen tactics where people will create transfers to a Roth IRA. And people, when you're late 50s, early 60s, that's a great tactic to use, because then you can take money out of those buckets and it's not going to show up on your tax return. So that type of planning, especially for wealthier people, is something that you should be doing, and that will help you substantially, and hopefully avoid IRMA.
Yeah, and that's one of the biggest things that retirees or pre-retirees are facing today is, how to withdraw funds from their retirement account on a tax-efficient manner. And part of that might include converting some money to a Roth IRA, before your RMDs kick in, but also to know whether that's going to affect your Medicare premiums. Because Medicare premiums, might be going up in 2026.
Oh, yeah.
Okay.
They're going up every year, unfortunately.
But in addition to that, you've got the deductibles. What do you think someone should be budgeting for Medicare every year? Because your Part B premiums are, let's just round it off to $2,000, but maybe increasing. Then you've got potentially a Part D premium, and then with the Medigap or Medicare Advantage, which I realize some Medicare Advantage, may have no cost or may have some cost. But, what do you think is a good annual budget for Medicare all in?
I think between $5,000 and $7,000 a year is a safe number for that. And I think that's whether you're on Medicare and a supplement and Part D plan, or if you're under a Medicare Advantage plan. And that is one of the advantages of Medicare Advantage, is most of those plans have 0 premiums, but you have a lot of cost sharing under those plans. So that's why I say it's, if you have a year where you might have to go to the hospital a couple times or have a major surgery, a lot of those plans have $6,000 and $7,000 max out-of-pocket expenses that you'll probably hit if you have a bad health year. So, my number is $5,000 to $7,000 with people, and if you're below that, then great. That means you've had a healthy year, not a lot of cost sharing, and your medications haven't been expensive either.
There's also a lot of talk that the expenses rise generally higher or faster than some other expenses out there. What do you think the inflation rate on healthcare is these days?
8%,
okay.
I think, is a safe number, unfortunately. There's a big transition going on here, both with the under age 65 world, which is called the Affordable Care Act, and with Medicare. And that world, yes, unfortunately, we're trying to make changes and trying to do things right for all of us, but again, it's expensive.
Okay, thanks, Paul.
Yep.
What we want to make sure people understand is, what does Medicare cover for, let's say, long-term care expenses? And, long-term care might be the need for assistance with some daily living activities. But can you talk a little bit about how Medicare plays into that, and whether there's any support for Medicare for long-term care expenses?
Yeah, good question, and often misunderstood. when clients ask me that question, I tell them, Medicare was originally designed to help people with doctors and hospitals. They never meant to be in the world of long-term care because really long-term care wasn't a thing back then in the mid-'60s. What happened is people worked for the same company for 40 years, retired at age 65. That's where that number comes from when we're eligible for Medicare. Went off of their group coverage, and we had to develop health insurance for people. And that's where Medicare started. If you receive any care for home health care, it's generally very, very limited. If you're in a nursing home and if you're labeled under skilled care, and there's 3 levels of care when we're in a nursing home. There's skilled, intermediate, and custodial. So you have to be under skilled care, which is the highest level of care. Then between Medicare and your Medicare supplement plan, the first 100 days would be paid for. But after that, even if you're under skilled care, no coverage.
Oh, that's very interesting. I know a lot of assisted living facilities can range anywhere from $6,000 to $12,000 a month. The cost might be a little bit lower if it's in-home, but those expenses can certainly mount up. And, in order to qualify for, because Medicaid can help out in long-term care expenses, but for that there are some qualifications. You must have limited resources. Do you have any background on that?
Yeah, I do, unfortunately, because we have clients that go through it. In order to qualify for Medicaid, you have to spend your assets down to $2,500 here in the state of New Hampshire. And some numbers will be $5,000, but let's call it, below $10,000 is what you can have in your name to qualify for Medicaid. And for a lot of people, that's a lot of money that's going to be spent until you can qualify for assistance from the state of New Hampshire. And again, Medicaid is not just for, people in nursing homes. Medicaid is designed for anybody that needs help with their health insurance. That's the single parent with 2 children at home. So there's a lot of people that are on the Medicaid program, not just people that have gone through all of their assets and now are at the end of their life needing care and a place to live.
Interesting. Paul, what's the biggest mistake you see people make when they select Medicare coverage or health insurance in general?
Not understanding the plan that they have, especially with Medicare Advantage. If a new person comes into my office and says I'm in XYZ plan, I'll start going through it with them and I'll start telling them, did you realize that if you spent the night in the hospital, it's $400 a night? No. Did you realize if you get really sick, you're going to be spending, $6,000, $7,000 max out-of-pocket expense? No. What people hear is, that dental and vision are involved. They hear that they can maybe get their gym membership paid. And I'm not blaming anybody here, but unfortunately, that happens way too often that people really don't understand what they have, especially in the Medicare Advantage world. Medicare supplement plans, it's a little bit more clear to people because there aren't as many moving parts. You pay a monthly premium, and maybe you have a small deductible, annual deductible, and that's it. Or maybe you have a plan that has a small deductible and a $20 copayment when you go to the doctors. Easy to understand.
Generally speaking, do you find that when you meet with people to discuss their Medicare options, do you find that people having participated in an HSA is particularly advantageous?
Absolutely. Yeah. And that's what I have myself. But again, I don't think it's common out there because I don't think either people that are doing it on their own are necessarily enrolling in an HSA compatible plan. And again, these are plans for people that are under age 65. What an HSA allows people to do is to set up a bucket of money that they can write off for tax purposes. So it's another, if you're maxing out your IRA contributions, your 401k contributions, you can put money into this HSA account. and get a deduction, and then you've got money there set up so when you need help with a copayment or a deductible, you're taking it out of that account. I think it's a great vehicle.
Yeah, I would love to see HSAs be available to anyone universally, regardless of whether they have a high deductible plan or not. I think, would you agree?
Absolutely, absolutely. And I wish they would take off some income limits too on being able to contribute. And I think we're going to see more of that stuff happening. They need to become more client friendly. And what I mean by that is for the general population to understand what they're enrolling in.
This has been fascinating, Paul. Throughout the year, should there be kind of ongoing education about Medicare, meaning getting people together, or should it be like right before the open enrollment begins? Is it beneficial just to kind of do educational information throughout the year?
Yes, absolutely. Yeah. The answer is yes, yes, yes. Just like with anything that we do, education is key, and health insurance is no different than that. Mm-hmm. We try to do, we call them workshops, whether those are at town halls or, libraries of our clients. We're always offering our services to do that, and people take us up on it. And it's a great way, relaxed environment. There's no selling going on. It's just educational. So we do those throughout the year. And we do ramp it up, obviously, during the fall, during the open enrollment periods when it's on the front of everybody's mind. But there's nothing wrong with, asking the person that you work with, for a review midsummer, just to see the latest and greatest what's going on and trends that will be happening for the next year. Because that's when we start to learn about these things, is July and August for the following year. So we're doing all of our education and our pre-work for the upcoming year then, so your advisors should know about that stuff, and I think it's a great time to do that.
Yeah, and tell our listeners a little bit how your practice is different than some other folks out there.
Yeah, thank you for that opportunity. We are consultants, and we have what we call an advisory agreement where people will pay us for our advice and our time to get independent advice. This year, probably 60% of the plans we wrote were non-commissionable. So to be able to sit in front of somebody that's not influenced by commission, I think is very, very important. And I think that sets us apart. We've been doing the consultant arrangement now for almost 10 years. And just like any other person that you're going to, you want independent advice. You don't mind paying for it as long as there's no bias in their recommendations. And that's exactly, I think, what separates us is, we're never influenced whether a plan is paying commission or not.
Thanks, Paul. This has been great. Really appreciate you joining me today. And just for everyone out there, Medicare can be complex. But if you work with a team, work with your financial advisor, work with your insurance advisor, you can cut through those complexities and really create an action plan that will, make sure that you're covered for your needs. Everyone's situation is unique, so it really is a good idea to have that conversation. Paul, really appreciate you joining us today, and thanks everyone for tuning in to Financial Futures, a Measured Wealth podcast. If you enjoyed today's episode, be sure to follow or subscribe on your favorite podcast app so you never miss an update. Want to learn more, get in touch, head over to measuredwealth.net where you'll find prior episodes, helpful financial planning guides, and more. You can also call us at 603-431-1444 or email at info@measuredwealth.net. That's info@measuredwealth.net. Thanks again for listening, and remember, the future will someday be the present.